Have you ever done everything right? Been kind, patient, respectful, even taken good care of your health, and still felt unsure in the bedroom? Have you ever wondered, am I really giving my partner the pleasure she craves, despite your best effort? If that question has lived quietly in the back of your mind, stay with me. There's a hidden factor most men miss after 60. When you understand it, you might be surprised by how much calmer, more confident, and more connected intimacy can feel. Without heroic stamina, and without trying to be 20 again. You've tried. You've listened. You've read advice. You've told yourself to relax. You've done your best. I want to honor that. The truth is, many good men carry a silent error into the bedroom without even realizing. It isn't about size. It isn't about speed. It's about rhythm, timing, and how a woman's body actually builds pleasure, especially after 60. Today, I'll guide you through an easy plan that respects real biology, protects comfort, and supports confidence. And if you stay with me, I'll reveal a #1 secret weapon at the end. Simple, respectful, and surprisingly effective that helps most seniors feel connected and successful again. Now let's talk about why this matters today. The problem creeps in quietly. It's gradual, almost invisible at first. You may notice tiny changes, less natural lubrication, slower warm-up, more need for gentle touch. You might feel pressure to perform, so you go faster or push through. Without even realizing, that pressure tightens your own muscles and shortens your breath. The body reads that as hurry. She feels rushed. You feel anxious. And the moment that could build connection slips away. Over time, this can chip at confidence. You may worry about stamina. You may worry about balance or hip comfort. You may worry, what if I let her down? Behind that worry lives a deeper fear, dependency. Will I lose my independence in the bedroom like I worry about losing it with mobility? Will I need help to measure up? I want to speak to that gently. Intimacy is not a strength test. It is a communication dance. You can regain confidence without straining, without pain, and without risking injury. We'll do it step by step. Let's reveal the hidden enemy in plain language. The unexpected culprit after 60 is mismatch. Mismatch between how quickly male arousal rises and how gradually many female bodies prefer to warm up, especially post-menopause. Mismatch between movie sex and real pelvic anatomy. Mismatch between rushing and the way nerves build sensation. Add in age-related dryness for many women, pelvic floor tension for many men, and the go-fast myth, and you have the perfect recipe for discomfort, frustration, and doubt. Not because you did anything wrong, because the cultural script is wrong for real bodies after 60. Here's the authority bridge, carefully and honestly. Clinical experience and everyday research in sexual medicine agree on a few simple points. Most women reach peak pleasure through consistent clitoral stimulation and steady, responsive pacing. Many women need more unhurried arousal time after menopause due to hormone changes that can affect blood flow and lubrication. And both partners benefit when stress goes down and breath slows. None of that means there is a one-size-fits-all rule. It means the plan works best when we follow human biology, not locker room myths. Here's the paradigm shift. What most people don't realize is that great intimacy after 60 is less about lasting forever and more about starting wisely, listening closely, and adjusting together. You don't need more force. You need a better map and a calmer engine. Now, let's walk a clear countdown from 8 to 1. We'll start with warnings, what to avoid, then shift into the solutions and alternatives that help most seniors. For each item, I'll name the problem, the plain language science, what it means in real life after 60, and a simple action you can take today. Stay with me for #1. It's a tiny technique that surprises most seniors and ties everything together. Problem: treating sex like a performance test. Science, plain. When the brain thinks test, stress hormones rise, muscles tighten, breath becomes shallow. That reduces sensation for both partners. Personal impact after 60. Tight hips and back, faster fatigue, more rushing, less enjoyment, confidence dips. Simple action. Rename the goal. Replace perform with co-create. Before intimacy, whisper, let's go slow and enjoy this. That simple phrase calms the nervous system for both of you. What's worse, when you aim to prove yourself, you may go harder and faster, exactly when her body needs warmth, softness, and time. Problem: Speed and depth before her body is ready. Science, plain. Arousal opens blood vessels and increases lubrication over minutes, not seconds. Nerves in and around the clitoris respond best to steady, gentle pressure early on. Personal impact after 60. If you rush, she may feel dryness or burning. You may sense her tense up. That tension raises your anxiety and shortens your stamina. Simple action. Start at half speed. Use shallow motion and close body contact. Think, warm up first, distance later. Add a small amount of a simple, body-safe lubricant early, not late. What's worse, pushing through early dryness can cause micro-irritation. Next time, her body may brace even sooner. The cycle continues. Problem: ignoring lubrication and comfort. Science, plain. Many women experience reduced natural lubrication after menopause. That's biology, not failure. Lubricant reduces friction and helps nerves feel good signals, not pain. Personal impact after 60. Without lubrication, motion can feel scratchy rather than warm. Pain can switch off arousal quickly. Simple action. Keep a trusted, body-safe lubricant where it's easy to reach. Use it before you think you need it. Reapply during position changes. Replace shame with care. Let's make this feel good. What's worse, once pain shows up, the brain remembers it. The next time, her body may clamp down earlier to protect itself. Problem: holding your breath and tightening your pelvic floor. Science, plain. Breath and pelvic muscles are linked. When you hold your breath, you often tighten your abdomen, hips, and pelvic floor. Tension reduces blood flow and sensation. Personal impact after 60. You may feel too fast or feel a sudden drop in control. She may sense a rigid, hurried rhythm. Simple action. Practice the 6-out breath. Inhale through the nose for 4. Exhale softly through the mouth for 6. Let the lower belly soften. Do 5 cycles before penetration and whenever you feel speed rising. What's worse, tight pelvic muscles can feel like more power, but they also shorten your timing and reduce her comfort. Here's the twist before we move to the top 4. You don't need a younger body. You need a calmer system. Calm builds sensation. Sensation builds connection. Connection builds pleasure. The next 4 items are solutions that stack gently and work with real bodies after 60. Solution: the warm-up window, 10 to 15 minutes that change everything. Science, plain. Nerves are like instruments. They tune with gentle, repeated signals. Blood flow builds with warmth, pressure, and relaxed breathing. Personal impact after 60. A short, protected warm-up reduces dryness, reduces guarding, and increases her confidence. Your stamina rises because your pace is steadier and your breath is longer. Simple action. Set a simple plan. Lights softer, phones away. 3 easy steps. 1. Full body touch over clothes or under a robe. 2. Gentle kiss and cheek-to-cheek closeness. 3. External hand or grinding contact at her pace with lubricant. Only when she signals ready do you move further. If she never wants to move further that night, you both still win, because comfort and connection are the true goals. Solution: clitoral first contact and the close contact grind. Science, plain. The clitoris is a larger structure than most people realize. It extends under the skin and around the vaginal entrance. Broad, close contact, pelvis to pelvis, stimulates this network gently and effectively. Personal impact after 60. Grinding with steady pressure can feel safer and more controllable than hard thrusting. It preserves your energy and gives her the stimulation most women prefer. Simple action. In positions like face-to-face lying or her on top, think rock and circle, not in and out sprint. Keep your pelvis close. Use slow, steady motion. Add lubricant early. Ask softly, more pressure here or here? And follow her answer. Let me clarify. Clitoral first does not exclude penetration. It simply means you prime her main pleasure network first, so any next step feels better, not forced. Solution: the tempo ladder. 3 speeds you can actually keep. Science, plain. The brain likes patterns with gentle variation. Too little variety and nerves adapt. Too much chaos and the body tenses. Personal impact after 60. A simple ladder helps you stay in control without counting in your head. She feels guided, not rushed. Simple action. Use 3 speeds only. Slow, S. Medium, M. Short burst, B. Start S for 2 to 3 minutes. Shift to M for 30 to 60 seconds. Return to S. When she signals there, add B for a few breaths, then back to S or M. Think SMSBS, never BBB. Your out-breath sets the rhythm. Stay with me for the #1 change. It's small, it's respectful, and it often transforms connection in one night. Grand reveal, the #1 secret weapon, the 60-second check-in plus hand signals. This is so simple most men overlook it. You set a gentle timer in your mind, about once a minute during active play, and you invite her to answer with one of 3 signals she chooses in advance. Green, 1 squeeze of your shoulder or hand equals keep this. Yellow, 2 squeezes equals same place, less or slower. Red, 3 taps equals pause or change. Why it works. Plain English. The brain relaxes when it knows it can steer. Her body stops bracing because she has a safe, fast way to say more, less, or different without breaking the mood. Your brain relaxes because you don't have to guess or perform. You only have to ask and adjust. How to set it up. Easy. Before intimacy, say, I want this to feel great for you. How about quick hand signals so you never have to hunt for words? 1 squeeze means keep it. 2 means ease up. 3 means pause or change. Then keep your promise. When she signals, you adjust immediately and thank her softly. Perfect. Thank you. That tiny thank you builds trust. Tie back to the opening promise. You didn't need a magic move. You needed a simple system that removes pressure, builds safety, and lets real bodies guide the night. This is that system. Let's deepen the plan with senior-friendly examples, plain science, and step-by-step actions you can start tonight. A. Breath plus body ease, fast engine. Problem, after 60. Tight low back or hips, stamina dips, rushing. Science. Long exhales shift the nervous system toward calm. Calm increases blood flow, which increases sensation and comfort. Impact. You feel more control. She feels more warmth. Action. Before intimacy, do 5 cycles. Inhale 4, exhale 6 to 8. Shoulders soft, jaw unclenched. During intimacy, breathe out on effort. If you feel speed rising, return to your long exhale. B. Comfortable joints, safer positions. Problem, after 60. Knees, hips, or back complain when angles are deep. Pain interrupts pleasure. Science. Stable joints allow muscles to relax. Relaxed muscles improve sensation. Impact. Less cramping, more staying power, better balance when changing positions. Action. Use pillows under hips or knees. Try side by side or her on top for joint control. Change positions slowly. Pause to breathe together before moving again. C. Lubricant early rule. Problem. Waiting for dryness to show up before helping comfort. Science. Less friction keeps nerve endings happy and tissues comfortable. Impact. More pleasure, less guarding, better rhythm. Action. Keep a body-safe lubricant on the nightstand. Use a small amount on your fingers and at the entrance before close contact. Reapply during position changes. Normalize it. This helps us both enjoy more. D. Listen with your hands. Problem. Guessing and pushing the same motion too long. Science. Nerves respond to gentle variety. Impact. She feels understood. You feel calmer. Action. Alternate 3 touches. Broad hand pressure around the hips, gentle circular grind, shallow motion. Every minute, check the signal. Green, yellow, red. Adjust to her cue. E. Respect the pause. Problem. Losing control once you feel close, then stopping abruptly in frustration. Science. Brief pauses reset the arousal curve without dropping it to 0. Impact. You regain timing, she keeps momentum. Action. When you feel too close, slow to stillness and do 3 long exhales while keeping close contact. Maintain gentle pressure. Resume at slow. If needed, switch to your hand to keep her rhythm while you reset. F. Aftercare is still care. Problem: ending too fast, leaving the nervous system half on. Science: oxytocin and endorphins rise with closeness and continue after climax. Impact: warmth, safety, and emotional connection grow. Next time, her body trusts the process sooner. Action: stay close for a few minutes. Breathe together. A hand on her heart or low belly. Whisper a simple thank you. This builds the bond that makes the next time easier. Common senior scenarios and fixes. My partner needs more time than I expect. Fix: use the warm-up window. Stay external longer. Keep your tempo ladder at S and M. Watch for green signals. No rush to the next step. I finished too fast. Fix: exhale on effort. Practice the respect the pause reset. Switch to grinding or hand contact while you breathe. Return at half speed. If this is a new pattern, discuss it with your clinician. Sometimes medications or health conditions play a role. Penetration is uncomfortable for her. Fix: lubricant early and often. More external focus, smaller angles, side-lying positions with a pillow between her knees. If discomfort continues, encourage a medical check-in. Pain deserves care, not endurance. I worry about balance and cramps. Fix: choose stable positions. Support your back with pillows. Change positions slowly. Breathe, then move. Hydrate earlier in the day. Gentle evening stretches for hips and calves can help. I feel pressure to be amazing every time. Fix: replace the test with the dance. Start with, let's enjoy and go at your pace. Keep your 60-second check-in going. You'll both relax. Plain language science truths that help. Female pleasure often builds from the outside in. Clitoral and surrounding tissue respond to steady, comfortable contact and consistent rhythm. After menopause, natural lubrication may decrease. That's common. Lubricant is a tool, not a crutch. Breath, not biceps, controls timing. Long exhale equals more control. Variety keeps nerves interested. Gentle changes in angle, pressure, and tempo beat hard, repetitive motion. Safety and comfort turn on arousal. When she feels safe, her body opens. When you feel safe, your timing steadies. Safety, consent, and medical sense. Consent is an ongoing yes, not a one-time ticket. The green-yellow-red system makes consent easy and sexy. Pain, bleeding, burning, fever, new urinary symptoms, or new pelvic pain deserve medical evaluation. Don't push through pain. If you have heart disease, recent surgery, uncontrolled blood pressure, or concerns about sexual activity, talk with your clinician about safe intensity and positions. Some medications affect arousal, lubrication, or erection. Bring questions to your healthcare professional. Adjusting timing or doses under supervision may help. This conversation is general education, not personal medical advice. Your situation is unique. Partner with your clinician to tailor these steps to your health. Step-by-step actions you can start tonight. Set the scene. Soften lights. Put phones away. Place lubricant within easy reach. Agree on the hand signals. 1 squeeze equals keep it. 2 equals ease or slow. 3 equals pause or change. Warm-up window, 10 to 15 minutes. Full body touch, cheek-to-cheek closeness, external contact with lubricant. Breathe long and slow. Choose joint-friendly positioning. Use pillows for hips or knees. Move slowly. Use the tempo ladder. Start slow, move to medium briefly, return to slow. Add short bursts only when she signals there. Respect the pause. When you feel too close, stillness plus 3 long exhales. Keep contact. Resume at half speed. Finish with aftercare. Stay close. Breathe. Thank her. Build the bond for next time. A short, true story style example. Names changed. David and Nora, both 68, felt pressure to get back to normal after a gap. They added the warm-up window, kept lubrication nearby, and practiced the 60-second check-in. Within 2 evenings, Nora felt safer and more comfortable. David felt less pressure to guess. Their confidence grew quietly, without even realizing at first. Mike, 73, had hip stiffness and rushed out of habit. Side-lying with pillows and grinding replaced hard thrusting. He breathed out on effort. His stamina improved immediately. Elias and Rosa, mid-70s, had avoided penetration because of dryness. With lubricant early, clitoral first contact, and gentle angles, Rosa felt good again. They both cried happy tears. It didn't take force. It took care. Your empowerment close. It's not too late. Bodies learn at every age. Nerves respond. Muscles soften. Trust returns. You don't have to become someone else. You simply need a calmer roadmap that respects real biology after 60. Here's a 5-step action plan to make this real. Step 1. Set a quiet intention. No test tonight, only connection. Step 2. Pick your warm-up window, 10 to 15 minutes. External first, lubricant early. Step 3. Use the 60-second check-in with green, yellow, red. Promise to follow it instantly. Step 4. Clitoral first contact plus close contact grinding. Then choose a joint-friendly position. Step 5. Breathe long, use the tempo ladder, and respect the pause. End with aftercare. A gentle, interactive invite. If this resonates, type 1 in the comments. If it doesn't, type 0 and tell me what you'd like help with next. Your experience guides this community and gives courage to someone who needs it tonight. Before we go, here's a small teaser for your next step to extend your progress. Next time, we'll cover a simple morning and evening stretch pair that reduces hip and back tension, so you move with ease and feel steadier in close positions. It pairs perfectly with the warm-up window and the tempo ladder you learned today. You've earned calm, comfortable, confident intimacy. Start small. Start slow. Listen with your hands. Breathe out. Use signals. Protect comfort. Let connection lead. And let pleasure follow. You don't need to be bigger or younger. You need to feel safer, move wiser, and love better. And you can start that tonight.